Welcome to On the Go, an International Society of Travel Medicine podcast. Join us as we sit down with travel medicine professionals to discuss what's happening now, from emerging health threats to clinical practice. Stay informed on all things travel medicine. Let's go.
Welcome, everyone, to the ISTM On the Go podcast. Today, we're talking about something that's at the heart of great travel medicine, collaboration. Whether you're a physician, nurse, or pharmacist, or another healthcare professional, we all bring something unique to caring for travelers. My name's Tara Lombardo. I'm current chair of the ISTM Nursing Professional Group from Canada, and I'll be your host today. So I'm really excited today to be joined by three colleagues representing different professions in travel medicine. So I just want to say thank you so much for being here today. Before we dive in, can we start with a quick introduction? Tell us who you are, where you're joining us from, and what you enjoy most about working in travel medicine. John, would you like to start us off?
Okay, I'm Dr. John Byron. I'm a GP, which would be a care physician, family medicine doctor, and I work in Dunedin, New Zealand. And I would say the best part of travel medicine, from my point of view, is the people, the travel, and the stories that come back. Plus, it helps encourage my fun of travel desires.
Agreed. Catherine, would you like to go next?
Yeah, sure. Thanks, Tara. So I'm Keil. I'm a nurse practitioner, originally from the UK, but now I'm based in South Australia. And I would agree with John. I would say I just love travel medicine because I like to learn about all these fantastic places travellers are going to, talk about them, get excited about their travels and try to keep them nice and healthy.
And Sheila, would you like to go next?
Hi, I'm Sheila Seed. I'm a pharmacist and I'm in the United States and the state of Massachusetts. And I would have to agree with both my colleagues here. I love to travel, but I love to hear the stories that they have. And I love comparing notes of, oh, did you do this? Did you do this? And when they come back for another travel visit. So, yeah.
I have to agree completely. I love the stories of all my travelers, and then sometimes it can help me educate the next traveler that comes in and say, avoid doing this, don't do this next time. One of the things that makes travel medicine so interesting is that no two clinics look alike, and around the world, our scopes of practice and responsibilities can be quite different. I would like to ask a few questions about the scope of practice that you guys are in. Catherine, would you like to tell us a little bit about your role in travel medicine and what strengths your profession brings for caring for our travelers?
Yeah, sure. So I trained in the UK as a registered nurse and moved into travel medicine when I worked for an airline in the Middle East. And now, as I said, I was based in South Australia and I own and run my own travel medicine clinic, an immunisation clinic. So the scope of practice for me is from vaccinations, medications, advice, all kinds of immunisations. I feel as a nurse practitioner, we kind of get the best of both roles as a nurse and also to prescribe. So you get kind of getting two sides of the coin, so to speak, giving a really good, consult and care for the travelers.
I agree. Is there any misconceptions about your role?
I think it's improving with misconceptions, but as a nurse practitioner, we have to explain quite a few times a day what we can do. People are quite surprised when they are informed we can prescribe antimalarials and antibiotics and so forth. So yeah, I think we just need to educate medical professions as well as our travellers and our patients.
I agree. Sheila, would you like to go next? Can you tell us a little bit about your role in travel medicine and the strengths your profession brings?
Sure. So in the United States, we have 50 different states and we have 50 different regulations for all the pharmacists. It can go from my state, which is very restrictive, all the way to actually pharmacists being able to prescribe malaria prophylaxis and, for medications for travelers' diarrhea. So I work with an infectious disease physician in his office. So we work together, seeing all our travel patients, and I provide the education part, but before they get into the office visit, I'll review their profile, especially if they're a former patient, checking all their medications, looking for drug-drug interactions, and knowing what we possibly will be prescribing them, I will check and look for drug-drug interactions and, of course, all the immunizations that they've had. I always say I have a captive audience. So if you haven't had your Tdap in a while, you're going to get a Tdap along with your the typhoid and everything else that you're going to need. The biggest misconception is people get confused when I come in and I introduce myself as a pharmacist. They're like, "What are you doing here? You're not in a community pharmacy setting, and and I'm not dispensing anything to you." So that is a little bit of a learning curve for patients to realize that pharmacists do more than just dispense medications.
Yeah, especially in Canada, it's same province to province. Pharmacists, nurses, it's like completely different scopes of practice what we're allowed to do. It gets a little bit challenging when you go to like travel medicine conferences and you try to explain like, oh, in Ontario we're allowed to do this, but then BC you can do everything or Alberta. Yeah,
Seems to be the West Coast because California can do everything.
agreed. John, would you like to go next?
Yeah, I'm slightly different. Even in doctors, there's wide differences depending on where you are in the world. In New Zealand, where I'm practicing, most travel medicine by doctors is done by general practitioners in the community. And we see patients throughout their lives for coughs, colds, injuries, their cancer, their heart attack, and everything else in between. And then some of us will have a special interest in travel and we'll see you for your vaccinations. And we see a lot of, in my practice anyway, pre-travel consults. And because many of them are patients in the practice, I'll know their histories really well. Have treated them before. So we get a great continuity. And I'm actually extremely lucky that my practice has a clinical pharmacist and a great nursing team. So I can kind of lean on them for questions when, especially there are new wonderful medications that I don't really quite understand. I have a clinical pharmacist that I can ask, can you help me out with this and make sure that everything goes okay, and have a look and make sure everything goes okay. And also there are skill sets that I don't have with regards to intradermal vaccinations and things like that, that my nursing team that I have in the practice are really good at and can help us get things done more efficiently so I can move through patients a bit quicker. So I have a bit of a collaborative practice as well. Doctors in other countries, we can have infectious disease consultants and tropical disease medicine working out of hospital clinics or institutions or their own clinics that they've set up. So I'm only looking at one part of the doctors that are out there practicing in travel medicine. So there are other ways that travel medicine is provided by doctors as well, not just the one I'm talking about in my experience.
I get it in Canada, well, in Ontario, where I'm from, it's not publicly funded anymore by the government programs, so it's all private. So physicians have really deterred away from doing any type of travel medicine in their practices and forward the patients on to travel clinics, which is good for me because I primarily do travel medicine every day. So it's good. I scoop up all their patients. So on that note of collaboration, a- at the end of the day, obviously our goal is helping our patients stay healthy before, during, and after their trip. So, as we know, providing the best care often means working together in a team. So, Sheila, you already said, but just to kind of in a little bit more detail, what does great collaboration look like in your practice?
I would have to say we actually have real-time conversations. We're not working in silos. I mean, I may do some workup, but before every patient, we sit and chat about, okay, I'm thinking about this for this patient, and do you agree or not agree? And I see the patient, and then there's always something that comes up, and I go back and I talk to him. And I always tell him my rate limiting step is finding him because he's got so many other patients he's seeing. But we had that real time conversation. It's like, oh, wait a minute, we didn't know about this, so we're gonna have to pivot and change something. So we really truly collaborate on every single patient because both of us will look at the patient ahead of time. We talk ahead of time, and then we both go back and see the patient, so they get a full, well, comprehensive, appointment that they get to see the pharmacist and the physician and the nurse all in one visit. So just like John's clinic, I'm sure.
Yeah. Catherine or John, would you like to add to that?
Mine's a little bit different because I don't have a lot of practitioners in the clinic. It's kind of, I'm running it myself. Having said that, I do collaborate with the local pharmacy in my area, my community area, who does a little bit of travel medicine. She refers to me and I ask her questions about weird, wonderful medications as well. So I think you can collaborate within your clinic, but also collaborate outside of your clinic, which is really important. It's a podcast, you can do it within your community with, other medical clinics. They phone, we speak regularly, but also within organizations like ISTM and the listserv, which is a great asset for me. If you have a question and you're not quite sure, you want a second opinion. So collaboration in travel medicine is key because, as we all know, things change constantly. Things are updated. Every state, territory, country does something slightly different. So collaboration is really, really important. But I would say for Sheila, I think that's fantastic that you have a conference pre each traveler or patient. That's amazing because obviously we're all time poor. So obviously, that's a great service for doing that.
Great. John, would you like to add anything to that?
I think everything is kind of being covered off quite well. I have to also deal and make sure I'm dealing with our community pharmacies, and there are a couple that are really good at certain things, and I'll guide people to things like there's one who always does graduated compression stockings, and I'll send them to them in particular because they do the correct measuring and do it in the right way. So it's knowing who does what, and sometimes it's just picking up the phone and going, look, I have a patient who goes to your pharmacy, but I want to give them this, this, and this. And this medication isn't something I've seen. Have they been on it a while? What's going on with it? And it's sometimes picking up the phone and getting that answer from a pharmacist or from their own practice, because I also see people from outside of my practice, gets us better answers, and it kind of helps everything move a little more smoothly for the patient's benefit.
Great. I'm very lucky. Actually work now in an office with an allergist, so I was very lucky on quite a few times to collaborate with him. And usually it's an 8-month waiting list, but I had an 8-year-old that just a little quick story. An 8-year-old that had a new onset of an egg allergy, and I had to give her yellow fever because she was traveling to Africa, Uganda, I think it was, with her family. And he just slid her in, monitor. Unfortunately, she did have a really severe reaction. So thankfully we're in the she was monitored and she was fine after, but I was very thankful for him being there and able to do that because getting into allergists can take a long time. I'm not sure if it's the same in every country, but super lucky.
Yeah, keep hold of that one because
Yes.
that's gold, really, isn't it? Because getting an allergist, especially a pediatric allergist, is hard. We have quite extensive waiting lists here in Australia, and actually finding one is quite difficult as well.
Yeah, sorry, Tara, you may not have noticed how all our faces went when you said allergist. Like, we all know what that means and how difficult it is. So yeah, I concur with Catherine. Hold him, nail him down, get someone to keep him at your clinic for the foreseeable future.
Well, he loves baked goods, so we have a nurse that bakes some goods every week.
There you go. There you go.
Good idea.
Anything to keep him. I guess my next question was actually just an example of teamwork that you've had experienced in the past that really benefited the traveler. But I think we kind of went over that a lot, unless there was an example of one that you wanted to discuss or talk about.
I think it's, from my point of view anyway, it's sometimes there are new drugs and especially medications called biologicals that cause immunosuppression that you may not have seen, may not have heard of, and you get the brand name sent through to you, and the brand name doesn't really mean much, and the patient may not fully understand what it's about or be able to tell you, and you're going hunting for it on the internet to try and understand, and then you've got to contact your colleagues, whether it's the specialist who provided it in the hospital or the pharmacist or a nurse specialist, and you're just trying to get everything together. And that's one of the big areas, new drugs, that is quite difficult in my opinion anyway.
Yeah, I would totally agree with John. It's all to do with the new medication and just getting your head around how it works, so that collaboration with the pharmacist is essential. So yeah, I would totally agree.
Yes, this every other day there seems to be a new biological. I'm like, oh my gosh, now I have to know what that one does. But yeah, it is difficult, but that's why we're all going to be working together, right? It's like we all bring something to the table.
And they all have really long, unpronounceable names as well. So
Yes, they do.
well.
So just before we wrap everything up, I have one final question for you all. If you could give one piece of advice to healthcare professionals looking to build a stronger interpersonal professional relationship in travel medicine, what tips would you give each?
I would say it's not a turf war. As we can see here, we've got a nurse, a doctor, and a pharmacist. We all work together. Okay. We can all do travel medicine. We can all help each other out. I do find some places it's, doctor v nurse, pharmacists, I think it's really important. We want to increase travel medicine consults. We want to increase vaccination rates. We all have a role to play in different settings, from, medical centers to private travel clinics to pharmacists to councils. We all can play. I think accessibility, access to us is really important, and prices as well. So I think if anything is taken from this podcast is we all have a role and we all should work all together.
Agree. I would say, at the end of the day, strong relationships actually need to better communication. And that is directly translates to our patients. And we have a better health outcome for our patients if we just all work together.
I'm personally of the view it's always good to go meet colleagues, have a coffee, have a chat about what exactly are you doing in your practice, and how can I help you and how can you help me? Like, I'm sure I have had a sit down and a chat with all of you with a coffee or something at some point over the last while. So it's just easy to do. And sometimes just asking about getting to know people means that everything gets easier when you do need to pick up the phone or send an email for help. They're more likely to help you if you actually have that personal relationship, and everyone is kind of going and not having the turf wars and more saying what is going to be best for the travelers in front of us, because that's who we're trying to help.
Agree.
There's no I in team. It's like a team. Not everyone knows every answer, and you have to reach out and ask is really important. Yeah.
But there is the Kobe Bryant answer to there's no I in team, but there is an ME.
That's true, John. That's very true.
Sorry, I know that was a bad joke. Okay?
That was a bad joke. But I think we need to traveler-centric approach. We're a team around that traveler, and working together is really important.
And sometimes we can see it here. We've got North Americans, we've got people from Australia and New Zealand. Different places have travelers who will take different risks. Like, New Zealanders are more prone to kind of go, she'll be right. I can do this ridiculous trip without any advice or anything. I can go to high altitude and I don't need to do anything and it'll all be fine. And then you can get people from Europe or North America who can come in and they want absolutely no risk. So it's trying to keep that in mind, and also trying to make sure that we help these people from whatever point of view we're coming at it, whether it's as a GP who's working in the community, whether it is a nurse or a nurse practitioner in a specialized travel medicine clinic, or in a clinic as a pharmacist, or in the community as a pharmacist, making sure that you're not alone. No matter what this person in front of you has, you can pick up the phone or send an email or contact a colleague or use the listserv that the ISTM has to get the best outcome for them at the risk profile they're willing to take.
I agree. No single profession can do it all. We all have to work together, and we need to be open to be able to talk to other healthcare providers to help provide the best care for our patients. Is there any other comments before we end today?
Gets lonely if you're working by yourself, as in,
Yes.
you know,
Yes,
we all love to travel, and in our profession we like a laugh because humor is important. So I think things like this podcast, ISTM, listserv, conferences that we all attend, various different conferences, is really important just to kind of increase our knowledge and our networking.
One other thing that can be useful is online peer groups in your local area where people who are doctors, nurses, pharmacists who work in travel medicine, who are in the same region, setting up your own local advice groups so that you can have a quick outreach to local people who are doing the same thing. I know we've done that here with some local doctors that are doing travel medicine, and it can be something that can be useful, especially for people who are doing it in a more isolated areas, so that you can get colleagues to give you advice when you get those head scratching moments.
I think we're really lucky with the nursing professional group too. We've set up a WhatsApp group, and we really try to post those really difficult questions. Sometimes you can't get an answer locally, so very thankful for those. All right, so thank you so much for coming today. And I know the time change is always difficult, but really thank you for sharing your experiences and perspectives. So hopefully the listeners will come away with some greater appreciation for the expertise that every member of the travel medicine team brings. And thank you for all your listeners. We'll hope to see you on the next ISTM On the Go podcast. Thank you.
Thank you for joining ISTM On the Go. If you enjoyed this podcast, please subscribe, share this with your network, and leave a review. For more information on ISTM or travel medicine, please visit istm.org. Until next time.